What's been very interesting, and I want you to keep in mind when we have the expert panel and when Dr. Caulfield comes up and starts talking, that there, in my mind, in my opinion, there are advantages and disadvantages to every single system out there, and you need to look at everything as a whole. So this is data from the New York Blood Center. So the New York Blood Center is the largest public bank. Sick kids got most of their cord bloods from the New York Blood Center when they did the transplants on kids, so it's available worldwide. And when you look at their data, you find that about 3/4 of the cords that were released were for some sort of blood cancer or blood disease. Okay? They were all allogeneic. So this is from an unrelated stranger going to the patient. Okay? Now I'm going to skip this, just go right to this. And this is just a small subset, but it's sort of like a little picture. So when you look at the private banks, and most of the private banks have their transplant data up on their website, and this is from a bank called Cord Blood Registry, which is in Tucson, Arizona. And I think now they've released a couple hundred samples for transplant, so the sample size is getting large. What they're finding is that in their samples, when you look at the data, it's the opposite. About 75% of the samples released for transplant are actually for autologous use, not for allogeneic. It's not for blood cancers. It's things for what you call cell therapy. There are, it's not on this list. Well, actually it is. So there are 2 samples on this list that were released to the University of Florida that, where the kids were treated for type 1 diabetes. There's a study going on at Duke University where they're using cord blood to treat kids with cerebral palsy. So it's interesting, now whether it was planned that way or not, I don't think it was, but you find in the public bank system, it's mostly allogeneic for cancer. In the private banking system, it tends to be for your for autologous, for regenerative medicine. Okay. And really, whether you're transplanting in a pancreas, a heart, a lung, an immune system, bone marrow cells, you have to consider a match. You just can't take anybody's, put it in, because your body will reject those cells. So there is something what we call autologous, which is basically your own cells. So we talked about that, the idea of iPS cells. Can I take my skin cells, make myself a new pancreas or a new immune system, a new blood system, put it in my body, it'll be free of cancer, there'll be no rejection issues. Then there's allogeneic, and allogeneic actually for bone marrow transplants is used more often, but here you're looking for a healthy person who doesn't have cancer who's going to be a donor. And they'll generally look first to a family member, and then they'll look into the public.